Welcome Nursing 575 students. This is Dr. Barber. I'm going to be going over the syllabus with you and Sakai a little bit so that you're familiar and you're prepared for class when class starts. So this is the syllabus, and I'm going to skip to page 2. So I want to point out a couple things here. First, our classes are going to be on Wednesdays from 10 to 3, and that includes an hour for lunch. I may change that later and make it a little shorter, but I want to start out that way because for the first 2 weeks for sure we have some very information-packed days, and you're going to need a little break to get out of there and clear your minds and come back ready to learn some more. Clinicals are on Tuesdays. They are all day shift. So most of the time it's going to be 6:30 to 4 p.m. However, there are a couple times it may vary slightly because of facility orientation things that you have that are different times, or your simulation days are different. So the simulations are on Fridays, however, twice during the course. Lecture will probably be in room 214. However, that's subject to change. The other thing I want to point out here is that you are actually doing an 8-week OB course and then an 8-week pediatrics course. So you're not doing them simultaneously. You're actually doing them consecutively. So OB first, peds second. We're hoping that that will help you to focus your attention on one clinical course and one didactic course rather than trying to focus on two separate clinical areas and the didactics associated. We feel like this is going to be a little bit better for you. I do want to point out though that you'll be in class for 4 hours every week, and it's about a minimum of 12 to 20 hours of work each week, depending on the week, of course, with everything that you need to learn for the course. So just be prepared that you need to designate enough time to do the work. Next, I just want to point out here that if you need to reach me, this is where you can reach me. I will make appointments for meeting with you for exam reviews, or if you have questions about class or some concern of some sort, you can make an appointment with me. I'm usually going to be doing it on Wednesdays. I don't typically come on other days, so we'll have to work around Wednesday's schedule. You can call me, email me, but I always want you, if you are going to be late or absent from class, you need to call me, leave me a voicemail, but you also need to email me so I can have a record that you did notify me. Because the class is accelerated now and you only have 8 weeks, I strongly and highly recommend you not miss class. 4 hours of content is a lot of content to miss, and basically it may be very difficult for you to complete the class successfully if you miss content like that, a 4-hour block. So really try very hard to attend the full class every week so you don't miss out on anything. These are your clinical faculty. If you need to reach them, this is their phone numbers and their email addresses. Please, same thing for them. If you have to miss clinical because you're dying, you are very sick, then I would prefer you miss clinical and not be there. However, once again, because it's accelerated, you have so few clinical days, missing a single clinical could mean you are not able to successfully complete the practicum. So it's critical that you stay well. Because of our population being newborns, you will not be permitted to be at clinical if you have fever, diarrhea, you're coughing, draining, nasal secretions. We cannot take any risk of having a baby or a postpartum mom or laboring mom get sick because of us. So I assure you that if you come to clinical sick, you will be sent home. This is the basic course description. This is the table of relationships, objectives, nursing standards, outcomes that are expected for both the bachelor's and the master's level, and what assignments meet those. I would recommend that you read it, just so that you're familiar with what your expectations are at the end of this course. This is how we evaluate our outcomes. These are the questions that we look at on the IDEA Eval specifically for this course. These are the required course texts: the Kaplan text, the Saunders book, and Murray and McKinney is your OB textbook you're going to be using. You can use the electronic version or the hard copy. Doesn't matter. Either one is fine. As far as these books go, I would say that the Saunders is probably my favorite for practicing test-taking questions. And I make assignments for both Kaplan and Saunders reading for after-class activities. I really feel like it's strongly and highly recommended that you do the Saunders, do the assigned reading, but then also do all the practice questions, because those students who have in the past done practice questions in Saunders and in Kaplan both tend to do much better on tests when they continually practice those test-taking skills. So no matter how good you are at test taking, it really will benefit you in the long run when it comes to NCLEX if you just keep practicing those test-taking skills. Other books that are recommended and I know are required for some classes is the APA manual. And then there's this maternal and newborn nursing success NCLEX review questions. It's also very, very helpful if you want to use that. Next, we're going to go to the calendar here. It's a grid, sometimes a little hard to follow because it's so busy. But for example, this is week 1, didactic, which is on Wednesday. All the topics that will be covered that day that you're going to be studying for. Pre-class reading assignments. This class is formatted differently. The expectation is that you come into class already having done the reading, reviewed all the PowerPoints, watched the videos, and I use a lot of videos because I find that students learn better when they not only read it, but they hear it, they see it. And also it's a great way to review after class to kind of pull everything together. Be sure there are going to be some articles also in some of the modules that you need to read, and there may be an assignment associated with those articles. Be sure you go through this total module prior to attending class because it's crucial for preparing for the weekly tests, because there will be a quiz. Every week that you don't have an exam, you will have a quiz, including week 1, because you can see right here, you have your first team quiz in the very first week. So you need to prepare ahead, and then the other thing is it'll also make you more prepared so that you can ask more specific clarifying questions in class, and you can add to the discussions we have about the various topics. So this is your reading. Here you can see that on each module right here you're going to find that it says bring completed module homework to submit at class start. And I'll show you a module in a few minutes, but every week for 7 weeks, you will have homework to submit at the beginning of class. If you are not there at the beginning of class, if you are not there at all, homework points are only awarded for those who actually attend class. Turn them in at the beginning of the class before we start. And I'm not so much grading them on accuracy as I am looking to see that you've completed them and done it, giving it good effort, to show that you are actually doing the prep work for class. That's my bigger concern, so that you're learning. Then after class, you'll notice that besides the team quiz and in class we'll do group work, but after class, this is where you're going to find the Saunders and Kaplan listed to review, and then I would do the associated practice questions and create your own little practice tests by putting in these topics here, and then you can put them into the Saunders allows you to customize. Okay, and then week 1, just to continue, you see here, this is the clinical for week 1. Now this particular week, oh, that's week 2, sorry, I jumped ahead. Okay, same thing. So for week 2, on the clinical day, you're going to be going to your facilities for some additional education and touring the facilities. And so there's going to be some specific things that are required for that. Secondly, that week, you're going to have another clinical skills day on site on Thursday, and we're going to be doing skills and the med math test that day. And this is specifically OB medications. This is not the general math calculation test that you do for several of the courses through the program. This is actually specific information to the OB nursing course. And let me just give you one more example from this. I'm going to go to the very last week of didactic, so week 8. And here you're going to see that in week 8, there's no topics because it's a cumulative team test that you're going to be taking, and that day you're going to be taking the individual Kaplan integrated OB test as well. So this day, basically you need to review everything that you've learned throughout the course, and we'll talk more about the content of the final later on, but just know that that's why there's no assignments or anything here. It's because it's the final and the Kaplan test. Additionally, you'll see here that there's a video reflection that you're going to be doing after this class session the following week from a movie that you're going to be watching and reflecting on. And then here, you're going to see that you're having a regular clinical day the day before the final, but then you're also having a simulation day the last day of that week. So on the Friday, you'll be having simulation. Now, one time the one group goes first, and the other time the other group goes first. So this is just a reverse of what you see for simulation 1 a few weeks earlier. So here's your time slot for your whole group, but there will be small teams that we will determine, and you will only come in for a 2-hour slot, each of you as individuals. So you don't have to worry you're not there for the whole day. You're just there for a 2-hour window of time, and that will be posted in advance for you to know. For this one, it will be posted after the first simulation in week 4, and then we'll post it after that. And then you'll notice that you have 1 extra week of clinical when you don't have didactic. And then that's the end for OB, and then you move on to pediatrics. Okay, and please note this too. This schedule, the topics, the exams, assignments, due dates, all of that can be changed based upon something happening. I get sick, or I decide that, I'm going to give you more time on an assignment. I'm not going to make it due on a certain day, or I'm going to make it due sooner, but you'll know all these things ahead of time. But I just want you to know that all of this is not set in stone ever, because I am flexible about some things, and we may have to make adjustments based upon what's going on. Next is the assignment grid here. So the name of the assignment is here. This is a description of what the assignment is here through the middle. The specifics about it, like what it takes to pass the medication math test, is 95% or better. You're going to have these clinical skill evaluations. You're going to be doing nursing care maps. Here is a homework module, so you get 1 point per week for turning those in and doing your best effort to complete them. And I will spot check the accuracy, but it will be spot checking, so you'll never know which week I'm checking that for you. I'm just going to randomly do that, but you're not going to lose points. I want to see that you're doing the work. Participation. Because of the team teaching model that I use, it's extremely important to me that you are actively engaged in the classroom, that you are learning, and the evidence of that is that you're participating in discussions, that you're asking good questions, you're using critical thinking skills, you actively engage in the team activities that we do, and that you're present. You can't get any team points for anything that we do on a day if you are absent. So if you are not in class, you will not earn the participation for that day. And that's for the 7 weeks for both of those, because the 8th week is just the exams. Here's the information on the video, Kaplan, and the team quizzes on the weeks that you don't have the exams, the course content exams. So exam 1 is 40 points, number 2 is 50, and number 3 is 60. And then the final team test. And something about this course that I should probably say here is that the model that I have it set up in is that I'm going to focus on normal first. So you're going to learn all the normal stuff, all the expected changes of pregnancy, all the expected behaviors of newborns. And once you get a foundation in normal, then we're going to move on to complications. So starting at the end of week 4, you'll start learning complications of the pregnancy. But up until that point, it will all be focused on normal, healthy pregnancies, moms, babies, etc. So I feel like students do better when we have a good solid foundation in the normal before we move into the difficult complications. Okay, I'm going to now scroll down to page 21, which is where we have the skills lab information. So the days that you have clinical skills and orientation are a total of 3. You're going to have one where we orient you just to a bunch of important content like fetal monitoring and breastfeeding and some other things. You're going to have another day that you're actually going to learn maternal assessment skills, newborn assessment skills. You're going to take the med math test, and we'll review some other things on that day too. But primarily, it's those 2 days. Then a third day is going to be spent at your facility learning or completing their education modules that they require in addition to what you do online ahead of time, and then also doing a tour of the facility, getting your name badges, parking, all that kind of stuff is going to be dealt with on that day. So you have 3 whole days where you're not even in the hospital because you're doing all this orientation. And that being said, there's no way to make these days up. So if you miss one of those 3 days, you will not be able to pass this course because we cannot remediate individuals on those 3 days. That content is only able to be given that one day. We can't make that up. So you absolutely must be there on those days. So be sure that you are well. Before the lab, these are all the things you need to read and prepare for the assessments, the medication math test, fetal monitoring, all those things we're going to be teaching you. This is all the prep stuff that you need to be doing for that. And there's a module I'll show you on Sakai. These are a list of all the skills you're going to be learning, and there are a lot. And then simulation, there's some information here about your simulation, but basically you're going to have 2, one in the 4th week and one in the 8th week. These are the pre-lab preparations, and then after the lab you will have a post-simulation debrief for both of those due online. And then the appendix here, there are several, as you can see. This one we'll talk about in class. I'm not going to go over it now. And in fact, we'll do all of these in class. So just know that they're all attached here for you, but they're also all going to be located in Sakai for you. Okay, next I want to just show you this. I'm going to post this calendar also with the syllabus. It's just a really fast, easy way to look at days and times and basic general information, but all the detail is in that grid that we just went over in the syllabus, okay? But I just wanted you to see that this is just a quick and easy. I do want to point out this one here, 8/17. This is the mandatory clinical makeup day for all courses and all students for all semesters. So if for some reason you're sick during clinical for either OB or peds, I'm sick on a theory day, your clinical faculty is sick on a clinical day and they can't make it up somehow, or the facility will not allow us to come because they have a survey by one of the regulatory agencies, then that's what this day is about. So it's not just that you're sick. It could be extenuating circumstances outside of all of our control, like the hospital saying you can't come this week, and it's happened every semester that something like that's come up. So I'm just letting you know, you may not make any travel plans until after this date and this time, because if you have to make it up in either peds or OB, you're going to need to come on that particular day. Okay, next, Sakai. So this is what the Sakai home screen looks like. I will occasionally post announcements here, so you'll get an email notification if I post some kind of a announcement. You can see the syllabus and the calendar on this screen. I don't have the syllabus loaded yet, but the calendar is loaded here. Next is gradebook. This looks like it does in every course. It lists all the different assignments and the points, and then what you earn will be listed here. Under the assignments tab, you're going to find your 2 simulation modules are going to have assignments due here. This is where the post simulation debriefs will be loaded, and also the video reflection will go here along with maybe one other assignment. Tests and quizzes, you won't see anything listed here until I open it, but one of the weeks of homework there's an online quiz that you're going to be taking, so it'll be linked to this tab here. This is the orientation and skills day information. So this is for those 2 days that you're on site, the first 2 weeks, and you're going to need to read through this very carefully. It's the same readings that I put on in the syllabus. Here it talks about the medication math test. Please note that you must pass at 95%, otherwise you're going to need to remediate. Talks about what's going to be covered. Here's some resources. There's also a medication fact sheet I'm working on. Hopefully I'll have it done in time for you guys because it's pretty detailed. And then all these videos. So there's fetal monitoring, there's maternal assessment, newborn assessment, gestational age assessments. There's breastfeeding videos to watch. There's some articles here. This is one of those times where I do put articles in that you need to read. There's also some labor basics here in video, very general. And then all of these forms here at the end, I recommend that you print out all of these to bring with you to the very first day of clinical orientation, and you'll need some of them for the skills day. But print them all so that you have them with you, so that as we're going through them, you can take notes on them. You can see what they look like, so you're familiar with them. That will really help you out. Okay, so that's the skills and orientation. Then you'll note that there are 8 modules, 8 weeks of modules. So I'm going to show you week 1. It's mostly done. It's not complete, but it's mostly done. Again, your readings, pre-class readings. These are where you're going to find the PowerPoints and the videos associated with this module. This is where you're going to find the homework, and I have one thing loaded here, but not everything. So there's this one here, and you just click on it to get to it. And then your post-class review, the Kaplan and the Saunders, are going to be listed here. So this is a typical module, what it looks like. I'm going to jump down to the last week of the, let me show you a simulation really quick too. So here's a simulation, and it gives you all the details of what you need, and all the preparation stuff is there. Okay, week 8. So week 8's a little more unique because this is the week that you have the final exam and that you have the Kaplan test. So what I've loaded here are some things that I think you'll find very helpful. First is these video topics from Kaplan, and it's just a list, but I would recommend printing this out. Where'd it go? There it is. These are all the videos that you can see in Kaplan. In addition to everything I've already given you, there's this whole long list. So if you need more information, if you need more help, I would go to these videos and watch them because they're very good also. Then additionally, I have this study skills folder for you. And in this, you will find it's a PowerPoint, and it goes over detailed information about the Kaplan study method, because it's a very helpful, it's the decision tree, and I strongly recommend, let's see if I can find the decision tree. There we go. And it's in your Kaplan book, so you should be familiar with this, but basically there are 5 steps, and you want to learn these 5 steps and utilize them as you're taking test questions. It also goes over a lot of other study skills, and like for example, this slide tells you all about websites to go to practice select all that apply. NCLEX will use a lot of those questions, and I put a lot on my tests to give you that practice. And that's why I give you this resource so that you can go there and practice those select all that apply as much as possible. And then last, I give you instructions about Kaplan. If you need to remediate, then this is the instructions for remediation. But that's all that's in here because this week is basically your final exam and your Kaplan test. Last thing I want to show you in Sakai, and then we'll be done, is the resources tab. In here, I have some exam study guides, but those may be changing, so we'll see what they look like. I'm not going to show them to you right now. And then the graphics, I can't close that, but it's nothing that you need to worry about. There's nothing in there. But these are a whole list of study guides that I found online that are very helpful. I will tell you that some of them aren't exactly matching up to what our textbook is or what I teach you in class. So just know that the bottom line is whatever the textbook says, that's the gospel, is whatever the textbook says. That's what I will follow for exams and everything. So use these to help you study. If they're helpful to you, you don't have to use them, but if you'd like to, you're welcome to. And then the other thing here in the resource tab, hang on, let me go back. Is more this is just the skills lab forms you'll find here also. So it's just another place to find them. But the study skills stuff here is helpful, and then these study guides are helpful. So those are just 2 more resources for you if you're interested. And I think that's everything I wanted to show you. So hopefully this has all been helpful, and I look forward to meeting you. And you have lots of stuff to get ready for class. The first week is really heavy, so I just want to warn you, be rested and bring lots of snacks to keep awake and to keep your blood sugar up, and you're just going to have a great time learning all these wonderful things you're going to learn about OB. So I look forward to meeting all of you, and we will see you in class in a couple weeks.